Hey everybody, this is a quick video just to direct you towards new quality treatment guidelines for anxiety disorders and OCD that the province of Ontario has released. So these are really great resources to understand what quality treatment looks like and how to track outcomes. These are for patients and for professionals. And I know things like this, these guidelines to help us understand what quality treatment looks like are so important because all of the time I see people posting, on forums saying, is this the right kind of treatment? Is this what I should be doing? This is what my doctor said. Does it make any sense? Or I get messages from people and they say, I've been doing treatment for years and things aren't getting better. And when they explain what they've been doing, it's just so far away from what we know is actually effective. These quality treatment guidelines were put together by Ontario Health Quality, and they're responsible for improving the quality of Ontario's healthcare system. I was super impressed with the skill of the team there and how they could bring together all of this input and all of this research into a cohesive tool. So there's a big committee of us. There were data science and epidemiologists, hospital administrators, psychologists, psychiatrists, patients, family doctors, caregivers. I was on the team as well. We worked on this for over a year, really looking at the evidence and looking at people's personal experiences and the reality of, what's available in terms of care and so on. And these resources are the result of that work. A couple of things to check out in the guidelines. There are several documents for each of the standards, the actual quality standard, a patient guide, along with the rationale and measurement tools. The quality standard document may look like it's for a doctor or a therapist, but all you patients out there, read it. You can understand it. You should know what quality care looks like. Right? If your doctor diagnoses you with an anxiety disorder or OCD and is immediately writing you prescriptions for antipsychotics and benzos, that's just not what the research tells us is going to be most effective if you want to get over these challenges. Both of the guidelines come with a patient guide that gives you some frameworks you can use to talk about symptoms, talk about goals in treatment, questions to ask your doctor or therapist. This is really important because there can be so much uncertainty before that initial appointment. And this gives you a guide through that uncertainty. And something I'm very excited about, of course, is that in the OCD quality standard, in the measurement and tracking guidelines, it mentions tracking reliable recovery as an outcome. Recovery is possible. Are you and your supports expecting that, working on the tools to do that, and most importantly, tracking that as an outcome? There's a lot more useful stuff in there. Big thank you to the Ontario Health Quality team for putting these useful tools together. When we're first navigating the mental health care system, or when we have a loved one who's trying to navigate the system, it can be really difficult to know where to go and what to do. So check out these quality care guidelines. This stuff is not a secret. I'll put the link for the anxiety disorder guidelines and the OCD quality treatment guidelines in the description below.